Season's greetings and welcome back to Baby Talk on Tiny Matters. I am Dr. Kutso Sivitseba, pediatrician, mom, and your host of Tiny Matters with Dr. K. They say babies do 3 things: eat, sleep, and cry. But sometimes it seriously feels like crying takes the top spot. If you're a parent who feels like their child is constantly crying, I know it can feel overwhelming, scary, and downright exhausting. So today, let's talk about normal crying, when to worry, when you don't, and when is it time to seek help. The truth is, all babies cry. It is their first and only way of communicating. Typically, crying peaks at around 6 to 8 weeks and improves by 3 to 4 months. Usually, it's going to happen in the middle of the night, the so-called witching hour. Crying spells may last minutes to hours, often without a clear reason. Remember, crying doesn't always mean pain. Sometimes it means I'm hungry, I'm overstimulated, or I just need you. Recently, Portia came to see me. She was a new mom and reported that her baby seemed to cry all the time. It seemed like nothing she did soothed his crying, and when she looked at his face, she could swear he was in a lot of pain. The crying seemed worse in the evenings and would often stop on its own without a clear explanation. This is what we call the purple crying period of infancy. Purple is an acronym that helps parents understand the normal developmental crying of infancy that is usually harmless but seems to go on for hours. Purple stands for peak of crying, which increases gradually and peaks around 6 to 8 weeks, then decreases. Unexpected, crying can start and stop without a clear reason. Resists soothing. Sometimes nothing works, even when parents try everything. A pain-like face. Babies may look like they're in pain, even when they're not. And long-lasting, crying spells that can last for hours. E is for evening cluster, where crying often worsens in the late afternoon or evening. This period is tough, but it's temporary and will go away by the age of 4 months. When Portia came to see me, the first thing I thought was, colic. Colic is defined as a baby who cries more than 3 hours a day for more than 3 days a week for more than 3 weeks in a healthy, otherwise normally developing baby. It often happens at predictable times, peaking at 6 weeks and getting better by around 3 to 4 months. We don't really know what causes colic, but we theorize that it could be an immature digestive system, as babies have more gaps with bloating or difficulty coordinating digestion, gut microbiome differences between adults and children, a sensory overload or an immature nervous system where babies struggle to regulate themselves when they're overstimulated, possible reflux or cow's milk protein sensitivity, but this is only in a small group of children, and family stress cycles. A lot of text has said that parental anxiety can sometimes make the baby's distress worse. Let's play a game of true and false. Colic means there's something wrong with my milk. False. Breastfeeding can actually protect against colic. Colic is from maternal diet. True and false. Usually false. However, in some cases, eliminating caffeine and dairy has been shown to help sensitive tummies. Colic is caused by teething. False. Colic usually resolves way before the teeth erupt. Colic will go away on its own. True. Remember, colic is self-limiting. It starts by around 6 weeks and goes away by 3 to 4 months. It's not your fault and it won't cause any long-term harm. Take a walk down the baby aisle in a pharmacy and you'll be met with a plethora of options that all promise to take care of your baby's colic symptoms. Simethicone is a common ingredient in colic mixtures and gas drops. It is safe, but there's very little evidence that it actually helps colic symptoms. Gripe water and herbal mixtures are not recommended. Most contain alcohol, sodium bicarbonate, and herbs that have not been tested in infants for safety. Traditional remedies, often sold in pharmacies, have become widely used across communities for colic and crying. Many of these are unsafe in infants. Ingredients may include alcohol, unknown herbs, and even some toxic substances. The danger with these substances is they can cause diarrhea, dehydration, chemical irritation, and in some cases, organ damage. Colic is often misdiagnosed as reflux, resulting in the incorrect prescription of antacids and reflux medication. The problem with these medications is that they can switch off acid production in the tummy, resulting in an altered gut microbiome, frequent gastrointestinal infections, and nutrient malabsorption. What works best is comforting strategies like swaddling, rocking, and skin-to-skin contact. In breastfed babies with severe symptoms, a trial of maternal dairy elimination can sometimes help, but only if guided by your doctor. Here are some comforting strategies that every parent can try. Swaddling, white noise or gentle shushing, rocking or rhythmic motion, skin-to-skin contact, as well as a warm bath. Sometimes nothing works, and that's okay. Put your baby down safely in a cot and take a short break. When it comes to your crying baby, a lot is normal, but these are the red flags to look out for. Seek medical care if your baby is inconsolable despite comfort. If they have a high-pitched, shrill cry that is different from usual, if the crying is associated with fever, vomiting, or diarrhea, if your baby has a distended tummy, a stiff posture, seizures, or lethargy, and most importantly, if your gut tells you that something isn't right. Here's the truth. Crying is a normal part of healthy babyhood, but it can feel heavy when you're in the thick of it. Remember, most crying phases pass. Colic resolves by 3 to 4 months, and you're not doing anything wrong. If you're ever unsure, speak to your doctor. We're here to help you. Thank you for joining me on Tiny Matters with Dr. K. Share this with a parent who's in the trenches of the crying weeks, because sometimes just knowing it's normal can bring the biggest relief. Here's wishing you and your family a blessed festive season, the most magical Christmas, and a wonderful 2026. Until next time, stay kind and stay curious.